Mushroom dishes have long been an integral part of both festive feasts and the daily diet of Russians, especially in the midst of the mushroom season. But how to use this product correctly so as not to harm your health? What are the benefits of mushrooms, and which of them contain the maximum amount of nutrients, and which are deadly? These and other questions were answered by Elena Kiselyova, therapist, endocrinologist in vitro Voronezh. What are the benefits of mushrooms? Mushrooms are a valuable nutritional product that adds variety to our diet and enriches the body with a variety of nutrients. All varieties of mushrooms contain fiber, which improves digestion, reduces blood glucose levels. Mushrooms contain vitamin D, which regulates the metabolism of calcium and phosphorus in the human body, and also has a positive effect on immunity, and which is especially lacking in the autumn-winter period. Mushrooms also contain B vitamins, B2 beauty vitamin, as well as necessary for the nervous and reproductive systems, and B3, which has a positive effect on the cardiovascular system, dilates blood vessels, reduces cholesterol. White mushrooms and oyster mushrooms are as rich as possible. In addition, mushrooms contain prebiotics, which has a beneficial effect on intestinal function and immunity. Mushrooms are also rich in trace elements, potassium heart work, copper participates in the absorption of iron, collagen production, energy formation in the mitochondria, selenium required for the immune, urinary systems. An excellent antioxidant, the latter, is most in shiitake mushrooms. And finally, mushrooms are rich in protein necessary to build all cellular structures of our body. How often and in what quantity can mushrooms be eaten safe for health? It is believed that it is better to eat mushrooms no more than 2 times a week for 100 to 150 g, and only after heat treatment, in which the agaritin toxin contained in almost all, including edible mushrooms, is destroyed. Can children eat mushrooms, and from what age? Mushrooms are a rather difficult to digest product containing certain toxic substances, so mushrooms in any form are contraindicated for use by children under 2 years of age. Children aged 2 to 5 years are allowed to use industrially grown mushrooms, champignons, oyster mushrooms no more than 1 to 2 times a month, preferably in boiled and finely chopped form, in the composition of any sauces. From the age of 5, white mushrooms caps can be introduced into the diet, processed in the same way and with the same frequency. From the age of 7, it is possible to eat wild mushrooms in boiled form, and from the age of 12 it is already possible to give pickled or fried mushrooms. In what diseases is it better to give up mushrooms? Mushrooms, due to the content of chitin, hard to digest fiber, are products with difficult to digest, so they are contraindicated in acute chronic diseases of the gastrointestinal tract, or in their exacerbation acute and chronic gastritis, peptic ulcer, colitis, duodenitis, pancreatitis, as well as renal and liver failure. Are there any foods that are better not to eat in combination with mushrooms? Nutritionists believe that mushrooms do not combine well with most products, and therefore it is better to eat them separately. The worst combinations are with potatoes, fish, flour products, cereals, zucchini, and carrots. According to nutritionists, they can be eaten with onions, cabbage, and peas. Why can you get poisoned with mushrooms? To begin with, all mushrooms are divided into edible, which do not contain life-threatening toxins, and inedible, in which they are present initially. We all know an example of fly agarics that contain muscarine toxin, which leads to irreversible vasodilation and death from heart failure, or pale toadstools containing several types of poisons at once, phalloidin, amanitin, phthalin. All of them can lead to deadly poisoning. But the use of conditionally edible mushrooms can also lead to poisoning. This happens more often due to non-compliance with the rules for collecting mushrooms collected along roads and railways, and mushrooms are known to accumulate heavy metal salts, radioactive elements, toxic organic substances. Storage cannot be stored in plastic buckets, bags, and no more than 18 to 24 hours, as protein decay products can also be poisoned. You can poison yourself with mushrooms and cook them incorrectly. Only some mushrooms can be consumed without prior heat treatment. The bulk of the mushrooms must be soaked and boiled for at least half an hour before further preparation, frying, salting. Also dangerous is the use of some mushrooms with alcohol, so-called ink mushrooms, or the abuse of conditionally edible mushrooms. How to wash mushrooms properly? Due to their great hydrophilicity ability to absorb water, it is recommended not to wash the mushrooms, but to wipe them with a paper towel or a brush with soft bristles and simply cut off the dirty or darkened part of the leg. How do you understand that mushrooms have spoiled and it's better not to eat them? It is better to store mushrooms not in polyethylene containers and bags and no more than 18 to 24 hours. But signs of spoilage can also occur in a few hours. The absence of matte shine, which is characterized by fresh mushrooms, the appearance of dark spots, black dots on the surface of the caps, moisturizing and slippage of fruit bodies, change in smell and darkening of plates on the back of the cap. What are the symptoms of mushroom poisoning? On average, the first symptoms of mushroom poisoning appear 1 to 2 hours after consumption. This period depends on the type and number of mushrooms eaten, the method of processing, whether alcohol was consumed and in what quantity, human body weight, age. These symptoms are similar to poisoning with other food agents: nausea, vomiting, abdominal pain, diarrhea. There may be muscle pain when poisoned by pale grebes, after which cramps appear. In case of fly agaric poisoning, in addition to general symptoms, increased salivation and tearing, increased sweating, narrowing of pupils, impaired consciousness, cramps quickly appear. In case of poisoning with panther fly agaric, on the contrary, there is dry mouth, dry skin, increased pulse, pupil dilation. Many toxins cause hemolysis, liver and kidney failure. As a result, respiratory and cardiovascular failure can lead to death. What to do in case of poisoning? When should I see a doctor? It is necessary to call an ambulance or take the victim to the hospital as soon as possible. Before the ambulance arrives, rinse your stomach with 2 glasses of clean water and then call vomiting by pressing a spoon on the root of the tongue. This method is contraindicated for pregnant women. Give any sorbent to drink. If there is no diarrhea, try to cause it with 1 tablespoon of Vaseline or castor oil. Drink plenty of alkaline mineral water without gas. Strong tea. It is strictly forbidden to take alcohol, antiemetics, antidiarrheal drugs.